Well, good morning and welcome to the second installment of our Hummel Group webinar series. We are glad you have taken the time to join us today. My name is Andy Yost and I'm a benefits risk advisor here at the Hummel Group. And I will be your host as we walk through just a few of the recent developments in response to the coronavirus pandemic. As a reminder, audio, again, just there is a dial-in number on the Zoom invite. If for any reason you have issues hearing us, your computer speakers or your phone speakers should work fine. Slides and recording. So after our first webinar last week, we had a number of you take advantage of these slides and recording that we had sent out. We will be doing the same thing after today's webinar, so keep a lookout for those. Q&A, as a reminder, use the chat or the Q&A box in the Zoom interface there. If you do have a question, we had a lot of good questions come out of the webinar last week, and we will follow up with your questions after the webinar today. And as you're going throughout the week, if you do have any questions, we do have the contact there. Email is questions@hummelgroupgrp.com. Our presenters, so Tom Gregory and Brian Thompson are back again today. Again, combined, they have over 50 years of experience in advising businesses on their benefits strategies. They represent a larger team, and as I mentioned last week, we have a diverse audience out there today. Some are clients, some are not. Again, during this time, I don't really think that matters. We want to make sure we're providing you information that then you can go and talk with your advisor, or if you do have questions, you can reach out to us directly. Resources, put this up there again, CDC, DOL. I cannot stress enough the importance of having factual and up-to-date resources during this time. And then a quick overview of today. So the CARES Act, it's a hot topic right now, and I'm sure all of you are somewhat aware of it. We are going to provide a 30,000-foot view of it. We're not going to drill down, but just want to provide a baseline of information for you. Telemedicine, perhaps this is the most exciting topic, in my opinion, that we're going to be discussing today. I don't think there's any more of a relevant time to be using telemedicine, knowing what your telemedicine strategy is, how you're communicating that to your employees. So we're going to go over that today. And we're also going to do a quick flyover of the Ohio Department of Insurance Bulletin that was released, and then also the FFCRA. And then to round it out, we are going to go over some frequently asked questions. Many of these come from the webinar last week. And then again, as a disclaimer, we are happy to have a conversation with you and advise you. However, we are not lawyers or accountants. So again, or bankers for that matter, if you're talking about the payroll protection program. So reach out to them if you do have specific questions. All right, so to start, we're going to go over the CARES Act, and Brian Thompson is going to lead us through this information. So, Brian?
Thanks, Andy, and good morning to everyone. Again, my name is Brian Thompson, and we appreciate you being with us today. And as Andy said, we're going to give you a 30,000-foot level look at the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. That was signed by President Trump on March 27th, 2020. And one of the biggest impacts actually started last Friday, April 3rd, through the Payroll Protection Program, in which there was a $350 billion bucket of money for individual businesses to look to use to continue to keep people on payroll that we'll go into in some detail in further slides. Highlights of what I'm going to talk about today is the impact on individuals, the impact on businesses, and the impact that the CARES Act has on healthcare. So as most of you have seen, the biggest, other than the Paycheck Protection Program, the other thing was the cash payments that was going to be sent out to individuals. It starts at $1,200 per person plus $500 per child. Now those are subject to income limits. Again, we're not accountants, so please reach out to your accountant if you have further questions on this. It starts at $75,000 for individuals. It will phase out at $99,000 on an individual basis. For couples filing their taxes, it starts at $150,000 and phases out at $198,000. One of the other big components of the CARES Act was the expansion of unemployment. So starting now, basically what will happen is if an individual goes on unemployment, not only will they receive what they would normally receive, which is roughly about 50% of their gross wages, but the federal government will be giving everybody $600 a week more. That will be there for 4 months. Now, to play that out, currently unemployment benefits last for 26 weeks. The federal government has also expanded that to 39 weeks. So when you think about that as an employer, your employees are going to be receiving unemployment benefits plus the extra $600 for roughly about 16 weeks of those 39 weeks. Something to really consider, and this actually just came to one of my clients the other day. There are going to be situations in which an employee who works for you that goes on unemployment will actually be receiving more money on unemployment. So there is a concern out there that some employers are concerned how they're going to get their employees back to work prior to that 4 months running out in which they're going to receive this additional $600. So please keep that in mind. And again, reach out to your accountant to have conversations as to what makes sense for you. So now we'll talk about some impact on the business, and basically that is where we go into the Paycheck Protection Program. Again, this started last Friday. It's a $350 billion bucket that allows a corporation to ask for a loan for issues revolving around payroll, up to $10 million per organization. The loans can be as much as 2.5 times payroll, and we'll go into some of the other things that you can put into this loan, one of which is going to be paying for healthcare premiums or health insurance premiums. As of Monday, and this is the most recent numbers we could get, as of Monday at 9:30 a.m., 130,000 loans had been applied for and $38 billion had actually been requested. I had a conversation just yesterday with my accountant, and he stated he has heard that there is conversation of another $1 trillion package coming out of the federal government that could obviously also add to these type of loans. So how to apply? Basically, the two ways to apply is that there is, as you see on this slide, there is a website you can go to. However, what we have heard and seen is that if you can go to your local bank or a bank close to you that has a SBA loan officer on staff, that is probably the easiest way to do this and usually get approval pretty quickly. The one thing that we must stress, and again, you can talk to your accountant on further details about this, but the forgiveness will only occur if you keep your payroll numbers exactly the same and you don't lay anybody off for the first 8 weeks. Those are some things to think about. And again, please reach out to your local accountant to ask more in-depth questions. So now we'll talk about some impact on the healthcare side. And again, the CARES Act kind of dovetails with what we talked about in our previous webinar, which was the FFCRA, which through both, it is mandated that all insurance companies are to cover all testing related items to COVID-19 at no cost sharing on the employee standpoint. They've also included in-person or telehealth visits, emergency room, et cetera. Those things need to be at a no cost sharing. Additionally, back on March 25th, and we talked about this in our previous webinar, March 25th, Aetna/CVS, which owns Aetna, came out and stated that they were going to cover all COVID-19 related costs at no cost sharing to the individual. Meaning if somebody is in intensive care or somebody needs to be in a hospital for COVID-19, there will be no cost sharing, no deductibles, no copays. Everything will be picked up by the insurance company. So in the state of Ohio, every carrier, so that includes Aetna, Anthem, Cigna, Humana, United Healthcare, Medical Mutual, all have stated that they are going to cover all costs related to COVID-19 at no cost sharing. The only two carriers in the state currently that are just covering the testing are SummaCare and AltCare. Additionally, we talked about this too. We've expanded services that you can get under your HSA account. You used to not be able to get over-the-counter medications and use your HSA money. You can now do that. They can also use your HSA to get surgical masks or any other drugs that are over the counter. Those will be eligible HSA expenses. Additionally, the HSAs, HRAs, and FSAs can be used now to cover certain menstrual care products, and all these will apply retroactively back to January 1st, 2020. And now I'll turn it back over to Andy.
All right. Hey, thank you very much, Brian. So now we're going to take a delve into telemedicine. What is it, commonly treated conditions, et cetera. So to cover that, we have Tom Gregory. So Tom.
Thank you, Andy, and good morning, everyone. Appreciate the opportunity to talk to you today about telemedicine. This is something that you're hearing a lot about in the news and with some of the news conferences we've been listening to the last few days. So what I want to talk about today is, what is telemedicine? What are some common uses for telemedicine? Advantages for using the service, and then how to communicate this service to your employees. All right, so what is telemedicine? Well, telemedicine has been available for a number of years, but it has grown exponentially in the last 5 years. The service allows patients to connect with a medical professional for non-emergency medical conditions. Medical providers can consult, diagnose, and prescribe appropriate medication when needed through a virtual office visit. The office visit is typically done through an app on the patient's phone or computer. So you'll see, again, depending on the provider that is providing the telemedicine, they have a way for you to connect through FaceTime, or if you have a camera on your computer, you can connect face-to-face with the doctor that way. And what we're now seeing is that all health insurers cover some form of telemedicine. All right, here's a list of some of the commonly treated conditions under telemedicine. And you can see on here, most of these would be, non-emergency type of services. Typically a person that is dealing with, an allergy, bronchitis, pink eye, somewhat knows what they're dealing with and knows that maybe they just need a prescription. And what telemedicine enables you to do is to connect on a virtual office visit with a medical professional who can then call in a prescription to your pharmacy. So you avoid going in to the doctor's office and again, virtual office visit with this individual that can call the prescription in to your pharmacy. A couple advantages to telemedicine. Patients can be seen from the comfort of their home and even at work if a private area is available. I have one client who has set up a designated private area at the workplace that if somebody wants to use the telemedicine service, they can go into this designated private area. They don't have to leave. They can have their office visit. Obviously this is someone that intended to come back to work after the office visit, and then they can go back to their job, pick the prescription up, during their lunch hour or on the way home. As I mentioned, less time spent traveling to and from their doctor's office is convenient for the patient. And again, if this is something that they can do at work, it can result in less time off work for doctor's appointments. Patients avoid being exposed to more serious illness and avoid exposing others to illness. Especially now, we're seeing a lot of doctors trying to roll out telemedicine with their individual practices. And the idea is that, they don't want you, if you are coming in, especially with the COVID virus, exposing other individuals, or if you're just coming in for, a urinary tract infection, that you're not going in and being exposed to someone that might be carrying the virus. Some insurers are providing cost incentives for telemedicine. If you have a health insurance plan that maybe has a $30 office visit copay, let's say, for your primary care doctor, you might find that the insurance company is giving you a lower copay. I have one specific example where the office visit copay is $10 when you're using telemedicine. So that's something that could save the employee some money by using this as an alternative. All right, so communicating telemedicine to employees, the telemedicine providers will vary by health insurer. So it's not a blanket service that you'll find out there. It depends on your insurance company. I would tell you, if you are interested in communicating this to your employees, reach out to us or reach out to your advisor, and we will provide documents or flyers, information pieces that you can give to your employees. Again, health insurers are providing these to us, and those information pieces typically talk about how to download the app, the cost per visit, if there is a cost, and again, we'll list the common conditions for telemedicine services. Just a couple statistics here. While the vast majority of mid-sized to large employers offer telemedicine benefit, believe it or not, less than 2% have used the service. I've used a telemedicine service. My wife has used telemedicine service. We had a good experience with our telemedicine through our insurance company. So I would encourage you, if you've not used it before and you are interested, one tip would be to go in and register your account before you're sick. There is some information that has to be input, such as your insurance information, your payment information, and you don't want to have to do that when you're not feeling well. In a recent survey, 40% of millennials said that a telemedicine option was extremely or very important, and millennials number 83 million members of the workforce. So as they adopt this as an alternative to going into a medical clinic or the family doctor, we're going to see this become a lot more prevalent. And the other statistic is just 60% of millennials have a primary care physician compared to 85% of baby boomers. So again, this, you're seeing the younger folks that don't have underlying medical conditions, that don't go to the doctor a lot, maybe not have a primary care physician, and they will find this as an attractive alternative to going into a clinic or a doctor's office. Okay, just some new developments with telemedicine and the COVID-19 pandemic. If you're watching any of the news conferences on a national or state level, you're seeing that federal and state officials are strongly encouraging the use of telemedicine right now. As part of the CARES Act that Brian just talked about, there's been $200 million allocated for the FCC to provide medical providers with connected devices to facilitate telemedicine services. So you may find, as I'm going to talk about here in the fourth bullet point, that many medical practices have added telemedicine as an option for seeing the regular family doctor. If you're using the third-party vendor, you're likely going to see a doctor that is not your family doctor. And if you feel pretty strongly that you want to continue to consult with your family doctor, I would reach out to their practice or their clinic and see if they are now offering some sort of telemedicine virtual type of environment where you can have your office visit. Some insurers have waived all costs associated with telemedicine visits during the pandemic. I have one for at least one that is now saying, even if you're just dealing with a sinus infection or bronchitis, if you use the service, they're going to waive all fees. So that's a no-cost office visit for using telemedicine. And then down there at the bottom, my last bullet point, according to Cleveland Clinic's Express Care Online's website, and I looked at that this morning again, they have waived all fees for telemedicine services. So and they've stated, regardless of your insurer or if you even have insurance. So if you have individuals that, in your company that are not participating in the health insurance plan, this could be a good alternative for them, at least during the pandemic, to access a medical consultation online with Cleveland Clinic's Express Care Online. You can go to their website and check that out for yourself. A couple benefit considerations here. What is your telemedicine strategy for rolling this out to your employees? You know, there are some statistics that say telemedicine is going to cost less than a family or for a traditional family doctor consultation. Heavy use of telemedicine over the period of a year could impact your loss ratios, so there's a benefit there. Employee communication is pretty easy. Again, we can provide flyers and information pieces for you to give to your employees, and just to create some awareness that this is available out there. The other thing that I want to mention here on benefit considerations is, do you have a formal continuation of coverage strategy beyond the COVID-19 pandemic? I'm going to talk here in a minute about, and many of you know by now, that you can continue to cover your laid off employees during this time, but what we are recommending is that you have a formal continuation of coverage strategy beyond COVID-19. Insurance companies will allow employers to establish, for example, we're going to cover a laid off employee for up to 90 days by the employee continuing to pay their portion of the cost. So again, this is a good time for you to look at those policies that you have in place, make sure that once we get beyond this, that you have some formal written policies for continuation of coverage for laid off employees, leave of absence, FMLA, and those types of situations. Okay, I'm going to switch gears here for a minute. I'm going to go back. We talked about this in our last webinar, the Ohio Department of Insurance Bulletin 2020-03 that was issued back on March, I think it was on March 22nd. Yeah, get my dates wrong here. But this is a result of basically on March 22nd, when we were put under a stay-at-home order until April 30th. That resulted in the shutdown of a lot of non-essential businesses. So the Ohio Department of Insurance issued guidance, or a directive actually, that during this time, the Ohio Department of Insurance said that health insurance coverage, or issued the bulletin that said health insurance coverage flexibility for Ohio employees had to be implemented. And this bulletin is in place until the expiration of the state of emergency. We can go to the next slide there, Andy. So some of the highlights of that bulletin are the employee eligibility provision that I just talked about. If you are laying off employees, the insurance companies are required to relax their actively at work requirements and their minimum hours worked requirements. So if you have an employee that was covered under your plan and they're laid off, or you're only working half-time, you are permitted to keep that employee, those employees on the insurance. You can ask them to pay their portion of the cost during this time, but the insurance companies are relaxing those requirements. I will tell you that the directive says that you have to apply this continuation or this extension of coverage to those employees on a uniform, non-discriminatory basis. So you should not be picking and choosing which employees that you allow to keep on during a layoff. It does have to be applied uniformly. The other thing I want to talk about is the grace period for premium payment. And we've had a number of our clients contact us about this. The insurance companies are required to extend the regular 30-day grace period for an additional 30 days for a total of 60 days. So for example, if you are now paying your April health insurance premium payment and you want to defer that, that can be deferred until the end of May. The process of this is varying by insurance company. So if that's something you want to take advantage of, please contact us or your advisor to find out how that is done. One of the insurance companies has told us we do not need to notify them. The others are asking for notification, and then they're sending an acknowledgement that yes, your April premium payment has been deferred to the end of May. However, keep in mind, if you take advantage of this, at the end of May, you may be required to pay both April and May at the same time. So think about that as you're asking for this deferment. Under continuation of coverage, I talked about how you can keep laid off employees on your plan, but that was a directive to the insurance companies, not employers. You are not required to keep a laid off employees on your plan during their layoff. If you decide not to continue their coverage, then you will have to offer them COBRA if you have 20 or more employees, or state continuation, sometimes known as mini COBRA, if you have less than 20 employees. There are some differences with the state continuation. For example, if your employee can get on their spouse's plan, or if you have younger employees that can get on their parents' plan or have eligibility for Medicaid, they are not eligible for state continuation. Again, if you have those specific situations, contact us. We'd be happy to walk you through what you can and can't do there. And then finally, the special enrollment. If you get to the point where you cannot keep your health insurance plan going, your company is either shutting down or you're just not going to pay for it, you're not going to ask for the deferral, and your health plan ends, this does create a special enrollment for your employees that were covered through the marketplace exchange at healthcare.gov. They can go there and apply for individual insurance. They may be eligible for a premium subsidy, also known as a tax credit. If they're not eligible for a tax credit, they can also purchase individual insurance directly from an insurance company doing business in this area. Again, if you have those situations, you can contact us for guidance. We would be happy to walk you through the specifics of your situation. As you can imagine, each of the individual carriers have some variations on how they're handling each of these things. Again, I know I've said it before, but I would encourage you to contact us if you have questions specific to your insurance company, especially when it comes to the deferral or the grace period deferring your premium. That can vary by company. The telemedicine can vary by company as well. We would be happy to help walk you through those specifics of the carrier information. Okay, I'm going to turn this back over to Brian, and he's going to talk a little bit more about the FFCRA.
Thanks a lot, Tom. And again, this was a topic that we discussed in our last webinar for those who are participating in this one also. Again, we're going to talk about FFCRA, which is the Families First Coronavirus Response. This was enacted on March 18th, 2020. Went into effect April 1st, 2020. So this has been in effect now for 7 days, and it will be in effect up until December 31st of this year as it stands. The provisions and highlights of that program that we're going to talk about today is the expansion of FMLA, the expansion of the employer paid sick leave, and also the mandates for health insurance coverage of COVID-19, which we did discuss a little bit earlier. So again, FMLA prior to the pandemic only applied to employers that had greater than 50 employees. Now through this expansion, it is for all employers that have fewer than 500 employees and all government employers. They must provide an additional 12 weeks of leave under the FMLA expansion for an employee who is unable to work or telework. And again, the last time we talked, I discussed and stressed telework. So if they cannot work from home and they need to stay at home due to taking care of a child who is under the age of 18 due to the fact that the school is closed or that their child care provider is closed or is unavailable due to an emergency related to COVID-19. That is the one way that they can get the expanded FMLA. Any employee who's worked with you for greater than 30 days is eligible. And the way that this works is that the first 10 days of the 12 weeks is unpaid. Now, an employee could take any PTO time, any sick leave time that they've already got to cover that time so that they can get paid for those 10 days. And additionally, in the next slide, we'll talk about the expanded paid sick leave. There is a component of that they could also get coverage for those first 10 days. After those 10 days, they will receive a benefit from their employer that is at least 2/3 of their regular rate of pay. consistent with the number of hours that they have been working, and it is not to exceed $200 a day or $10,000 in the aggregate. Now we'll go into the emergency paid sick leave. And again, it is the same criteria. An employer that has less than 500 employees and all government employees must provide sick paid time off for an employee who is unable to work, or again, telework, due to a leave because of COVID-19. Under the emergency paid sick leave, all employees are eligible. So anybody that you've hired, they could be there 1 day, 5 days, whatever, they are eligible. And this component of the FFCRA Act is broken down into two reasons for having paid sick leave. The first is for sick reasons. If the federal, state, or local governments have filed a quarantine order, a stay-at-home order, or an isolation order, that would allow an individual to get the paid sick time. Additionally, if a healthcare provider has advised that employee to self-quarantine due to interaction with somebody who has COVID-19, or that employee has experienced symptoms or is seeking diagnosis, they would be able to get the paid sick leave for those reasons. The other reasons would be for care reasons, and that would be as if they are providing care to a family member who is subject to a government quarantine, or who has been ordered to self-quarantine due to a healthcare provider feeling that they have been in contact with somebody or are having symptoms. Additionally, as I said in the last slide, they also can receive the emergency paid sick leave if they are providing care for a child under the age of 18 whose school or child care provider is closed. Next slide, Andy. All right, so this will work for you. A full-time employee would receive 80 hours paid sick leave. A part-time worker would receive paid sick leave equal to the scheduled time or the normal work hours that they would regularly get paid. For these sick reasons, an individual can receive up to $511 a day or an aggregate of $5,110, not to exceed either one. And on the care reason side, they could receive $200 a day up to $2,000 in the aggregate. And again, going back to my previous slide, if an individual has to stay at home for their child, they could get both the emergency paid sick leave for the 8 hours, which would give them that first 10 days, and then they would then go into the FMLA extension. Now, because this is a cost to an employer, the federal government has basically said that they are going to give tax credits to employers who have individuals that go on either the extended FMLA or the paid sick leave. And how they are going to do this is they are going to give you a dollar-for-dollar credit on your federal payroll taxes that you would file on your 941. And that dollar-for-dollar credit includes both what your matching contribution is, as well as the taxes that you withheld from the employees. You can hold that money to offset any costs that you've had due to extended FMLA or the extended paid sick leave. This can also include any employer-provided health insurance costs to you. We'll go back again and talk about the coverage mandates from COVID-19 through the FFCRA. And again, we discussed it earlier through the CARES Act and additionally through the Ohio Department of Insurance Bulletin 2020-05. And again, this states that all insurance carriers are required to cover all testing related to COVID-19 that's approved through the FDA at no cost sharing to the employee. So no copays, no deductibles, no pre-authorization. All of that is to be covered at no cost sharing. This includes commercial insurance. It also includes Medicare Advantage plans, Medicaid, CHIP, and TRICARE. And as we discussed in the previous slide, all carriers in the state of Ohio are also now covering all expenses related to COVID-19 at no cost sharing, except for SUMA and AltCare. On top of that, additionally, the Department of Insurance, through that Bulletin 2020-05, has also stated that insurance carriers must cover out-of-network emergency services just like they are covering in-network emergency services with no balance billing. Now I'll turn it over to Andy.
All right. Hey, thank you very much, Brian and Tom. Back on the telemedicine, I just talked to a coworker today that actually used Teladoc last night. He had poison ivy, called it in, got a prescription. So I think if we've learned something over the last several weeks, I think we're going to be relying a lot more on technology, in the coming weeks and months. And then I think just like we've used to adopt Zoom for meetings, Teladoc and telemedicine is going to be commonplace moving forward. So like Tom mentioned, it's important to have a strategy for your business, and also very important to know how you're going to communicate that to your employees. So a few FAQs we received from last week's webinar in regards to the FFCRA. So the first one, which I believe Tom is going to answer, I'll read it off here, Tom. If an employee takes extended FMLA under FFCRA to take care of a child because their daycare is closed, does my business have to continue other benefits such as medical insurance? So Tom?
Yeah. So the answer to that is yes. For those of you that work with companies that have 50 or more employees, you may be accustomed to FMLA, where you do have to continue health insurance. Those of us that have less than 50 employees, obviously FMLA has never come into play. So this extended FMLA does follow the same regular FMLA rules that says you must continue to provide health insurance to that individual. Now, again, going back to the extension for laid off employees, you can require that employee to pay their portion of the cost during that time. And you can handle this a couple different ways. You could ask them to pay that as they go, or if you're confident that the individual is coming back, you could also defer their portion until they get back from FMLA and collect it at that point, or maybe extend it over several paychecks or several months after they've come back. But the answer is yes, you do need to continue those medical benefits during the extended FMLA.
All right, thank you, Tom. All right, next question, which I believe Brian will be answering. Question is, will employees be able to receive both paid sick leave and paid FMLA leave?
And again, thanks, Andy. The answer to that we just kind of talked briefly about in an earlier slide, and that answer to that is absolutely yes. And that would fall under, if somebody is taking care of a child at home, they could apply for the paid sick leave and receive the $200 per day up to a maximum of $2,000 for the first 80 hours that they are out, which would cover those first 10 days that the expanded FMLA does not cover. And then after that point in time, if they are still out due to taking care of a child, they would then get the $200 a day max up to $10,000 for 10 weeks through the expanded FMLA. And then our next question, Andy, was if I decide to provide FMLA leave before the effective date of April 1st, will I be able to get the tax credit for the benefits paid before the effective date? And the answer to that is no, you will not be able to. Anything that you did prior to the FFCRA going into effect April 1st does not come into play with the benefits. So if you did any type of FMLA leave prior to April 1st, there would be no tax credit for you. The next question would be is what obligation does the employer have to inform employees of the new FMLA paid sick leave rights? And again, this is just like our current FMLA. You must post new posters that lay out the expanded FMLA as well as the extended paid sick leave that are currently being distributed. Those need to be posted in an area very similar to where you have your current FMLA posters. That is something that you will need to do so that your employees are informed of their rights. Again, in our previous webinar, I discussed that communication with your employees is absolutely vital during this time. And then lastly, the question was, as a small business owner, I'm not able to let all similarly situated people work remotely. Is there a problem with allowing some people to work remotely and disallowing others? This is a really interesting question because I believe there's going to be a lot of leeway that the federal government is going to give small business owners I believe that good faith is what they're going to look at. And so as a small business owner, again, we know as small business owners that most people are cross-trained and some people can work from home and some can't. It is not going to be an issue if you do have some of your employees working from home and others that you disallow because you need them there at the office. As long as you're doing it in good faith, I believe that the federal government is going to be on your side with this. And now I'll turn it back over to Andy.
All right. Hey, thank you very much, Tom and Brian. As we've been sitting here, I've seen a number of questions pop in. We will be following up with you guys directly to address those. If you do have questions, as we go throughout the week, email questions@hummelgrp.com. And again, I have the website up there for our coronavirus resource page. And then follow us on Facebook and LinkedIn to keep up to date with more. So again, thank you guys for attending today. We really appreciate your time, and have a great rest of your day.